We actually went somewhere else first and they wanted a lot of money and they wanted to pull teeth and I just wasn't comfortable.
So when you're young, if you have a narrow maxilla, it can keep your teeth from having room to grow in. For Aiden, his canine teeth are really tight on space. So you got a V-shaped palate. It's more angular than it is U-shaped. We want a U-shaped arch, and then we can consolidate the space and make room for his permanent canines to grow in. So the main goal is to get him a proper arch form and shape and increase the volume of the maxilla so that it can better accommodate the permanent teeth when he grows older. They grow in better, they grow in straighter. Sometimes a tooth can get stuck if it doesn't have anywhere to go. The jaws fit together better so that the lower and upper jaws grow symmetrically with each other. If you have asymmetric upper and lower jaw widths, it can affect the way the mandible grows. You can grow asymmetrically. There's good evidence to support that expanding the palate expands your nasal airway, so your nasal breathing improves. So I'm gonna have you do one thing for me. I'm gonna have you just open real big. I'm gonna dry it off. I'm gonna put it in, and I'm gonna try and have you keep your tongue just a little lower than it is. There you go, just like that, okay? I'm gonna dry this off. I'm gonna take this expander. We're gonna put it in just like we did when we dry fit it. So it should go in really easily. Yep, very simple. And that fits real nice. So I'm gonna have you do one thing for me. I'm gonna have you just open real big. I'm gonna dry it off. I'm gonna put it in, and I'm gonna try and have you keep your tongue just a little lower than it is. There you go, just like that, okay? I'm gonna dry this off. I'm gonna take this expander. We're gonna put it in just like we did when we dry fit it. So it should go in really easily. Yep, very simple. And that fits real nice. I'm gonna go ahead and clean any extra glue off of it and make sure there's no glue inside where your brackets go, just by blowing a puff of air between it. And then we're gonna set it up, okay? Open big for me. It stays wet until I shine this light on it, and then that sets up the adhesive so that the expander will stay in position.
He had an injury when he was a toddler. Our dentist recommended Dr. Sanders, and when we started with him, we were very impressed. He's done all of this with his own kids. He's great with the kids. So I asked a lot of other moms and friends who have maybe had the same experience. I didn't know anything about him, but it's been an easy process so far. So with Aubrey, she just had a tooth that was coming in a little odd, and she didn't have enough room. So our dentist recommended getting some braces on. It looks really, really good. It's really helping improve her smile, but her tooth now has room to come down from shifting the other teeth. I highly recommend them. They've been fantastic. They have been quick to answer all of my questions, and I have a lot of them, especially with having two at the same time. I've had a lot of questions, and they've worked with me on everything and explaining things thoroughly. They've been fantastic with the kids. They're so patient with them and do a fantastic job of explaining things to the kids as they go through the process. And they've also worked with me with scheduling both kids at the same time, so I don't have to make the drive so often. I highly recommend them. They've done a fantastic job with our kids and making sure the kids are comfortable throughout the process and giving them the smiles that they deserve. We would definitely come back. We have more kids coming, so I'm sure Carson's gonna need them.
All right, my friend. You did good, I'm proud of you. High five.